Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and this is COVID-19 World News, January 9, 2021. The feature presentation today is the incidence of anaphylaxis in COVID-19 vaccine patients. This data has been compiled by the CDC, so let's review. CDC reports on allergic reactions, including anaphylaxis, after the receipt of the first dose of Pfizer BioNTech COVID-19 vaccine. The data collected was between December 14 and December 23, 2020. Before we go any further, for the benefit of those who are viewing this from a non-medical perspective, what is anaphylaxis? Anaphylaxis is a serious immediate allergic reaction to a vaccine or any type of medicine given either orally or intramuscularly or intravenously. It may be characterized by diffuse erythematous rash. Some people may experience a swollen tongue or lips. Some people may develop urticaria. Some patients may have wheezing, stridor, nausea. Some may experience hoarseness. Some people may develop itching all across the body. And occasionally people may have persistent cough. And these symptoms are pretty serious and they need immediate attention. According to the CDC report, the observation period, as I said, was between December 14 and December 23rd. They looked at 1.89 million doses of Pfizer BioNTech vaccine recipients. Anaphylaxis, as described in the previous slide, was seen in 21 people. That is, the incidence is 11.1 per million doses of COVID vaccine. 17 of them had history of allergic reactions. This is an important point I would like to underscore, because 17 out of 21 had some kind of an allergic reaction in the past. That is why history taking is of paramount importance in identifying some of these people and being prepared to handle an anaphylaxis in case it happens. 71% of these people developed anaphylaxis within 15 minutes with a median of 12 minutes. That means these patients need to be observed for a minimum of 15 minutes, and some people may develop reactions later on as late as a day. But nonetheless, within first 15 minutes, more than 70% of them who are going to have anaphylactic reactions will be identified and they need to be appropriately managed. In addition to serious anaphylaxis, they also recognized 4,393 cases of some sort of a reaction, which could be just like little bruising, it could be little urticaria, could be mild itching, could be mild symptoms that may persist for some time. But 87% of them were not serious to need a medical attention. And here's a breakdown of those 21 people who had anaphylaxis compared to those who had minor allergic reactions. Like here's 21 versus 83. There was not much difference in the age group, and also, interestingly, 80% of the people who got anaphylaxis were females, but that shouldn't come as a surprise because more than 70% of the people who received the vaccine were females. The mean time for onset was 13 minutes and it was 12 minutes here. Symptoms less than 15 minutes, there's not much difference. The main difference is those people who had anaphylaxis, 81% of them had previous histories of serious allergic reactions, and 7 of them had history of anaphylaxis to medications. So if we have a history like that, we need to be extremely cautious when we administer these vaccines and be prepared to handle these patients appropriately when they do develop these serious symptoms which I talked about. The most important thing is prevention. The second step is recognition. The third step is appropriate prompt treatment. We should be screening everyone for history and contraindications. We should have necessary equipment to handle any type of anaphylaxis. People receiving vaccines should be observed for 15 minutes. And we need to strictly follow post-vaccination observation guidelines. If we don't, we could get into trouble. And prompt treatment of symptomatic patients with epinephrine. That means we have to have epinephrine readily available. We also need to have equipment ready to resuscitate a patient if necessary and have means of transporting them to the emergency facility if needed. Majority of these people who had these reactions were in a hospital setup or in the emergency center. However, if you are doing this in your clinic or in the field, make sure you have all this necessary equipment to deal with an anaphylaxis so that you can promptly treat them. But the good news is most of these people who had severe anaphylactic reactions responded promptly to the medications and none of them needed any hospitalizations. Ladies and gentlemen, this is a brief review of the first almost 1.893 million doses of Pfizer BioNTech COVID-19 vaccine, which caused severe anaphylactic reaction in 21 patients, which is like 11.1 per million doses of vaccine. So the vaccines are relatively safe, but when it happens in a given patient, it is a pretty serious matter and needs significantly prompt attention. Before I conclude, I would like you to take a look at the COVID-19 pandemic book I have written, which is on Amazon, and here are my other books. Thank you so much for watching this presentation on anaphylaxis noted in COVID-19 vaccine recipients. Please do subscribe to our YouTube channel and we will see you next time.